Mark Harper, 63 Conservative MPs have signed this letter. Is there any reason why only you and Steve Baker publicly signed it?
Yes, we did the same as with this when we wrote to the Prime Minister last autumn. My own view is this is a letter to the Prime Minister. Obviously, the Prime Minister's been supplied with the names of all of the colleagues who've signed it. But my own view is it's for colleagues themselves to say that they support what's in the letter rather than for us to do it on their behalf. So Steve and I have signed it. The Prime Minister's got all the names of the colleagues that have signed it. And obviously, a number of colleagues have already indicated publicly that they're supporting it. And I think that's a perfectly reasonable way to proceed.
Aren't there internal structures that you can use to make points like this, like getting a meeting with the Prime Minister and discussing it in private?
Yes, there are. And we've used those. I've fed in my views privately as well. But I think sometimes you have to put a little bit of pressure on publicly to get the right outcomes.
And is this something, the contents of a letter that you circulated to all colleagues, all of the Tory MPs, but most didn't want to sign, or did you just approach selected colleagues?
No, we predominantly, I mean, obviously, those members of Conservative colleagues who are in the government can't sign letters like this anyway. So, no, we circulated it to those colleagues who we thought were most likely to sign it, those in the COVID recovery group. And we're very pleased with the support that we've got.
OK. There's a lot of reporting about what form unlock might take. I mean, I have to say, some sound quite cautious, apart from schools, which we'll discuss in a moment, but a suggestion that at the same time as schools opening, we might be able to have a coffee on a park bench with one person from outside the household. How did you feel when you read this morning's reports?
Well, our own view is we've set out in the letter what we think is sensible, and we've linked it. They're not random, arbitrary timetable. It's linked very much to the rollout of the vaccine. So our argument is we've now protected, and the government has hit its target for getting the top 4 groups protected by the 15th of February. So once those groups are protected, they account for nearly 90% of deaths from COVID and over and around 55% of those that go into hospital. We think that's the right point once they're protected, once that vaccination's kicked in from the 8th of March, that you can get schools back and you can start then relaxing the restrictions elsewhere. We think by Easter, when you've done 2/3 of risk groups 5 to 9, that's everyone over 50 and everyone over 16 who's got a health condition that makes them vulnerable to COVID, you can sensibly open hospitality for Easter, which is a really key date where it makes the difference between them staying in business and not. And then once you've protected all of those 9 groups, that's 99% of the deaths from COVID and 80% of hospitalisations. We think that's the point at which restrictions domestically shouldn't really still exist, because you've protected all of the people who are vulnerable to COVID.
OK, let's go through some of the points
Sure.
in your letter. You mentioned pubs and restaurants to be open by Easter. It says in a COVID-secure way in your letter. Does that mean outside only?
No, it means following all the restrictions that the hospitality industry put in place before. I mean, we'll all be familiar, having used hospitality businesses last year, that they had social distancing between tables. You had protection for the staff. People had to wear masks when you were travelling around the venue. We think all of that's very sensible. And if you look at the evidence, there's almost no evidence that hospitality venues were venues that were COVID secure, where there was any significant transmission of COVID at all.
OK, so we can eat and drink in pubs or restaurants along the same terms as we did last time. So perhaps table service rather than congregating at the bar, masks when you go to the loo, etc. That sort of thing you want to be in place by Easter.
Yes, I think that's sensible. Yes, we're not proposing to go back to no mask, no social distancing by Easter, and everyone congregating around a bar. We think in a COVID secure way, all these businesses have invested a lot of money in making their premises COVID secure. And we think that they're perfectly capable of opening by Easter, when we've protected the top 4 vulnerable groups and we're well on the way to protecting the 9 most vulnerable groups. We think that's a sensible balance, which recognises that for many of these businesses, if they aren't able to open, they aren't going to be in business for very much longer.
Okay. One point that really stuck out in your letter was this point. Once all 9 priority groups have had a vaccine by the end of April, there is no justification for any legislative restrictions. So I hope that's a fair summary of the point you made in that letter. So in around 10 weeks or so, there will be no restrictions at all. Everyone will be at work. Everyone will be on tubes, buses, house parties, big weddings, sporting events, theatres, festivals like Glastonbury, you name it. We're back to normal.
Well, all the justification for the restrictions that have been put in place, which, let's be frank, are the most severe restrictions ever put on British people outside of a global war, were justified to save lives and to protect the National Health Service. Now, once you've vaccinated the top 9 groups, who represent 99% of the people that have sadly died from COVID, and about 80% of those that are seriously ill, and you've protected them through vaccination, I don't think there is a justification for all of these draconian restrictions. If someone wants to make the case for those restrictions remaining, well, let's listen to the arguments. But once you've protected people from serious illness and from death, then I don't think these draconian restrictions on being able to not meet your family, not see your children, not see your parents, not visit people in care homes, I just don't think they're justifiable anymore.
Yeah, sure. But what about getting on packed tubes, buses, going to the office, having a big wedding? The things that you might say maybe are less essential than seeing your loved ones and your family.
Well, I think having a wedding, once you've got all of the risk groups have been vaccinated, you can obviously have things in place. Venues can have testing in place and things like that. But I don't really see any argument about why you wouldn't have those events being able to take place. We know the vaccinations also slow the transmission of the virus as well. So the whole point is we are leading the world in our vaccination rollout. The government's done a fantastic job on vaccinating people, but the point of vaccinating them is that they're then protected from the most severe effects of COVID, which means you can then get back to people being able to live their lives in a way that's as normal as possible.
Would you like to see people back at their office desks? Obviously, it's COVID secure workplace. I think it might be what you mean. But in your ideal world, to support those dry cleaners, the sandwich shops, the restaurants, the bars, we all know what's happened to retail. Should people all be back in the office by the end of April?
Well, I think there's 2 things. First of all, where businesses want people back in the office, then I think they should be able to be back in the office. But I think we should also reflect that what's happened over the last year and people being able to work remotely and businesses understanding the level of flexibility, I think we are going to see some permanent changes actually in how businesses operate. So from that point of view, I don't think businesses are all going to go back to working exactly how they were working before, not because of COVID, but because they've actually worked out that there are lots of benefits to both themselves and their employees from being able to work more flexibly.
But if a boss wants you back in the office at the end of April, it's safe to do so.
Well, yes, I think offices are operating in a COVID secure way. And once you've vaccinated the top 9 groups, so that, as I said, that's everyone over 50 and everyone over 16 who's got a health condition that makes them vulnerable to COVID, then I think people can safely go back to work, the people that aren't already in the workplace, yes.
Okay, you focused a lot about the vaccination of vulnerable groups, and of course that is crucial. However, some scientists say you've got to look at the infection rate too. You've got to use that as a measure. So, for example, Professor Stephen Bailey, he's a member of the government's SAGE modelling group, SPI-M. He stressed yesterday the vaccine rollout did not mean infection rates could be ignored. I quote, "We're certainly going to be in the situation where we can allow more infection in the community, but there is a limit to that." So the science wouldn't support that view because infection rates, not just vaccinations, but infection rates should be a consideration too. Do you accept that infection rate should be a measure?
Well, I think you've got to look at doing this over time as we roll out the vaccination. But once you've protected the most vulnerable people, no, I don't agree with him. And actually, neither does the government. Last week in the House of Commons, Matt Hancock made it clear that the four things the government was looking at, infection rates were not one of them. It was death rates, hospitalisations, the pace of the vaccine rollout, and also just keeping an eye on any new variants to make sure that the vaccine is still effective against them, which we know that all the vaccines are currently effective against all of the variants. So the government itself isn't using infection rates as one of its indicators for relaxing restrictions. So that's not just my view, that's the government's view set out by the Health Secretary in the House of Commons this last week.
It's difficult getting a balance between scientific decisions and political decisions, isn't it? It's a hard judgment balancing act for the government to make. So, for example, Professor Graham Medley, chairman of the Scientific Pandemic Influenza Group on Modelling, SPI-M, he said this about a week ago, about 8 days. The government should make decisions dependent on the circumstances rather than being driven by a calendar of wanting to do things.
No, I actually agree with him. Two things. It is very difficult making these decisions. And we've been very clear in our letter that it's not driven by a calendar of arbitrary dates. It's driven by the milestones on the vaccine rollout. So the vaccine rollout is what is going to protect those who are vulnerable. So we've tied all of our requests to that vaccine rollout. So protecting the foremost vulnerable groups is where you can start relaxing restrictions from March the 8th. And then the end of restrictions is when you've protected the top 9 groups. Now, we've said the end of April because that's what the government has said its target is for getting that done. Clearly, if that were to slip, then obviously you'd have to keep restrictions in place for that little bit longer. But it's tying the restrictions to the rollout of the vaccine, which I think is a very scientific and evidence-based way of relaxing restrictions. It's also worth saying, Gloria, in terms of the pace, that say we were to get rid of all the restrictions as we've requested by the end of April, that means everyone in the country will have been in a form of lockdown for 4 months for the third time. People in the north of England, you know that well from your previous experience, have been in some form of lockdown for the best part of a year. I don't think that can be defined in any way as rushing to get out of lockdown. This is a careful, paced way of exiting lockdown as we roll out the vaccination to protect the most vulnerable.
Do you think there's any doubt? It was clear that the government would like to open schools on the 8th of March. You included it in the letter. I just wondered if you were worried about that stated aim of opening schools.
You do hear people suggesting that's not sensible. I heard a senior member of the National Health Service management yesterday on the radio suggesting that schools shouldn't come back on the 8th of March. They shouldn't come back for many weeks after that. So I do think you have to keep making these arguments. I know the government wants to bring schools back on the 8th of March. We very much agree with that, and I hope that's what we'll see happen.
If the government don't get rid of all restrictions by the end of April, as you would like them to, it's just tough, isn't it? There's more people who haven't signed the letter than have. You just have to accept whatever the government determine is the right way to unlock. You've made your points, but you have no power to make sure they're implemented, really, do you?
Well, look, clearly it depends on the numbers in the House of Commons, but I think it's right to set out our arguments. I very much hope people can read the letter. We've published the letter, can read the letter. The tone of the letter is very much wanting to encourage the government to reach a point that actually we can all unite around, that the country and Parliament can see that there's a sensible roadmap that the Prime Minister sets out on the 22nd of February, tied to the vaccination rollout to protect the most vulnerable. And I very much hope that he'll be able to set out something on the 22nd along the lines that we've suggested that we can all get behind. And I'm very hopeful that that's what will be able to be happening.